Well, next tonight, some exciting research has been published by doctors in Leeds who care for very poorly children born with heart disease.
For the first time, they've been able to prove that babies who undergo a particular keyhole procedure stand a better chance of survival than those who undergo full open heart surgery. Our health correspondent Jamie Coulson reports.
At 2 years old, Taniesha has had a difficult start in life. The toddler was born with a complex heart condition, meaning only half of it worked properly. From birth, she struggled to get enough oxygen around her body.
You fall in love with something so little, and could somebody take that away? It's just a constant fear. I walked in one morning and she must have just stopped breathing for a while, and they were intubating her, and you're just in tears. It's just so scary. You just think, is this today? Is it going to be today?
When Taniesha was 20 days old, she needed a life-saving procedure to increase blood flow to her lungs. But instead of having open heart surgery, she underwent a keyhole procedure that was pioneered by doctors in Leeds in the 1990s and has its inspiration in the treatment of adult heart attack patients.
So this is the catheter.
A small plastic tube known as a catheter is placed into a blood vessel in the groin. From there it travels up to the heart and into the arterial duct, a blood vessel used by babies in the womb that normally closes soon after birth. Once in position, a small wire mesh tube called a stent is inflated by a balloon. This locks in position and keeps the blood vessel open, allowing extra blood to flow to the lungs.
This is about there and it comes back on itself.
Keyhole procedures are a rapidly advancing area of medicine in children's heart disease. Doctors are now able to treat a wider range of conditions and more complex cases without the need for open heart surgery.
I think we're done.
Now, for the first time, doctors have been able to prove that babies who undergo that particular procedure have a better chance of survival than those who undergo open heart surgery.
So the balloon is inflating the stent.
Dr John Thomson is part of the team who analysed the results of children at hospitals across the country.
There's a significant survival advantage, but not only that, these children require less intensive care. These children are back to normal very, very quickly indeed. Often later on that day they're feeding normally and often able to go home within a day or two of a procedure like this.
She's just amazing. She's just full of fun. We're thankful every day to everybody who helps us. There's not anybody who meets her who doesn't just fall in love with her. She's like extraordinary.
Taniesha is among the 100 or so children across the country who benefit from this procedure each year, and now doctors can prove it gives the best chance of life. Jamie Coulson, BBC Look North.